Well, everyone, it's time to resume the program. Welcome back if you took a little break. We'd like to introduce Dr. Carrie Finno from UC Davis School of Veterinary Medicine. We invited her to present to us um, about her genetic program that UC Davis is doing and that she is managing there about C6, C7 neck issues and kissing spine. Um, Dr. Fino, I would like to give the word to you. We already made you co-host so you can share your screen and your presentation. And thank you so much for doing this for us.
Super. Thank you so much for having me. Can you all hear me okay?
Yeah,
Yes, ma'am.
Thumbs up? Okay, fantastic. Let's get this up and going. How does that look on your end?
that looks great.
All good? Okay. All right. Well, thank you so much. Thanks to Anna, Elizabeth, and Kelly for the invitation to come and speak to this group this morning and afternoon, respective of where you are. So I'm Dr. Finno. I am a professor. Oh, can you hear me okay?
Yeah, maybe everybody
Okay.
please unmute or mute yourself so we hear only Dr. Fino.
Great. Thanks. I'm a professor of veterinary genetics at UC Davis, and I'm going to go through some of the current research on kissing spine and C6, C7 neck malformations. And then I would ask if you have questions, please just put them in the chat. You can put them in the chat as we go, and then we have some time at the end to go through them all and also how you can get involved with this if you've had a case or would like some more information. So with that, what I'd like to go through is first, we're going to start with kissing spine. We'll talk about the clinical presentation, and then we'll focus a bit on the genetics and where the research is right now. And then we're going to talk about the C6, C7 neck malformations and really how they differ from what we all know is quote unquote wobblers or compressive myelopathy. And same thing, we'll do the clinical presentation and the genetics. So let's start with kissing spine. So what is this, right? This is the term we use to call this overriding of the spinal processes. And we, vet med, everybody loves our acronyms. So ORDSPS, there's kissing spines. So I have an x-ray on the left of a normal back. And then on the right, this here is a horse with kissing spines. And you can see how these are very, very close together. And you start to get some changes to the bone. And we'll go through some specific examples and cases. But in contrast to the normal horse, it's pretty obvious in this case that there's some changes there. So as far as the definition goes, they have to have overriding of two or more thoracic, so that's kind of right along the middle of the back, or lumbar, which is getting into the hindquarters, vertebral spinous processes. And so that space is lost, right? So instead of that nice 4 millimeter or greater space, now they're very close together. And when that happens, there's actually bone on bone involvement. And so you get bone lysis or bone loss. And then what happens when you lose bone is the body tries to come in and lay down more bone. So then you get these areas of sclerosis around that region. So if we just look at the normal back in horses, it's really interesting the way things are laid out, right? So right here is kind of where our saddle is going to be. And so these vertebrae, so these are thoracic 1 through 14, which is really, again, where the saddle sits, they all face backwards. So they're angled caudally, meaning that the top of them points towards the tail. And then when you get to the middle here of the back, you have these two vertebrae, so T15 and T16, that sit directly upright. And this is effectively our change of direction. So then when we get behind that, T17 through the lumbar 6, so now we're getting towards the tail here, these face forward. So you can see how, right, there's this chance of these running into each other effectively as they change direction. And it's pretty interesting that that's the anatomy and a little bit of what we run into. So I know this is a busy grading system, but this is what was proposed by Dr. Zimmerman's group. And this is actually what's used by most organizations to grade kissing spine. And I'm just going to kind of break it down simply because this is the way I understand it. So 0 is normal. So this is that they have more than 4 millimeters between those vertebral processes. 1 is mild. So this is where it's a little less than 4. but pretty mild, and there's no real changes in the bone. Then you start to get where they're closer than 3 millimeters, and that can be divided into mild, moderate, and severe. And then we start to get into the pretty bad category. Grade 5 is where the shape starts to change. Grade 6 is actually where they're now fused together, so they're that close. And then 7 is where you have very, very severe abnormalities. And I'll show you an x-ray of what that looks like. So there's grading, right? So it's just like everything. And I think we tend to be like, oh, this horse has kissing spine, yes or no. And I would urge everybody to say, well, what was the grading if there were x-rays taken? Because it does make a big difference. And I don't think every horse that has narrow processes should be thrown into this same category, right? There's this variation. So let's just go through a couple examples. So this is a 10-year-old warm blood gelding, and we've got T14 labeled here and then T18 here. And so these black arrows here are pointing to what would be a grade 4. So they're pretty close together, right? We can kind of see that. And if we go back to our grading scale, a grade 4 is close together and severe bone changes, which we're starting to have. So you see it's kind of brighter white here. You see this kind of black area here. Then the white arrow is pointing to, this is narrow, but it's more mild. So that would be a grade 3 there. So this horse has 3 sites of grade 4 and 1 of grade 3 is how we would classify this particular horse. So here's another case. This is a 13-year-old thoroughbred gelding. And the black arrows again are pointing here to some grade 4s. So again, really close together. And we see some bone changes, especially on this one. And then the white arrow here is going to point to some more mild closeness here with mild changes. So those are grade 3. So this horse has 3 grade 4 sites, 2 grade 3 sites is how we'd specify that one. And then this one's particularly bad. So this is a 6-year-old warm blood mare. And the black arrow here is pointing to a grade 7. So remember, a grade 7 is now where we have a congenital malformation, meaning congenital, all that means is the horse is born with it. So the horse is born effectively with these bones pretty much completely overlapping. And then this is a totally abnormal shape to the back. So this whole area is very abnormal. And this would be a case if we were talking about who to exclude from the breeding pool, it would be something that looks like this. And we'll get into your organization and that you are actually excluding stallions that have something this severe, which is really, really commendable. So that's the worst end of the spectrum, right? And that's a horse, I would argue we shouldn't be breeding. There are some other grading systems out there, which just makes things more complicated because everybody wants to have their own grading system. This is a paper that focused on the genetics, and they just used a score of 0 to 4, 0 being normal, 4 being pretty bad. I would argue that Zimmerman scale I showed you that goes up to 7 is the most well-accepted scale. And that's what many of us are using to grade these backs. But just so you know, there are other scores out there to complicate things. So what about breeds? So there have been multiple studies really dating back to the 70s to say that kissing spine is overrepresented in thoroughbreds and warm bloods. It's not to say we don't see it in quarter horses and other breeds, but we really tend to see it in thoroughbreds and warm bloods, which brings us back to is there something genetic? So diagnosis, really x-rays are the mainstay of diagnosis. You can do bone scans. So for anyone that's had a horse with a bone scan done before, this is where they inject a tracer, IV, and the tracer goes to areas of bone that are remodeling, so they're actively changing. And I always think of it as like a functional scan. If you don't know where the horse hurts, you can do a bone scan. And so this is a horse's back. This is what a bone scan looks like. And this black arrow is pointing to a really what we'd call quote unquote hot area, meaning that area took up a lot of that tracer because that bone is actively remodeling and inflamed and irritated. So if this was my horse, I would say, ooh, this is the area I should really focus on. The gray area, there's a little bit of uptake there, kind of moderate. And then we see normally, you kind of need to know what normal is because you might go in and say, well, look at these areas. But those processes normally take some contrast up. So in this horse, this region at T16 is pretty severe. So the bone scan sometimes can be nice because maybe you see something on x-rays, but is that really bothering the horse or is that just an ugly x-ray? And this will tell you, hey, this horse at T16, that's really bothering that horse. So it's nice to have functional validation in some of these cases. Many people will ultrasound these cases. We mainly focus on x-rays and bone scan. And then really the gold standard to say is whatever the behavior is, the horse doesn't want to go forward, the horse is having trouble cantering. Is it due to what you saw in x-rays or not of the back, is to actually block the back, just like you would block a lower leg. And so there are a few different ways to do it. Effectively, you're putting a needle straight between here or on either side or at an angle. So there's different techniques, but the idea is to block that area, right, with something like you would in a lower leg with carbocaine, and then re-ride the horse. And if the horse feels better, chances are the pain was coming from there. To not do this step and to just say, hey, the x-rays look bad, this is probably what it is. I would say, especially if you're thinking about any kind of surgery, you really should block the horse first and make sure that's where the pain is coming from, because you don't want to go through a whole surgical procedure and have it be that this actually wasn't the cause. So that brings us to, the association with back pain. I think kissing scan gets blamed for a lot of things that maybe it's not necessarily causing. So some really nice studies that looked at, this was 482 horses, of which over half were warm bloods. And so what they said was, okay, well, how many dorsal spinous processes are, quote unquote, overlapping? And then the number of horses here. And then the black are horses that have no back pain, and the gray are horses that have back pain. So if you look, the horses that have no overlapping, no kissing spine, the grade 0 here, most of them, right, almost 65% have no back pain. But there are a few that do. So this is probably due to another cause. And then as we go through and we see more and more of these kissing spine, right, really when we start to get to 5, 6, 7, 8 sites, 9 sites, now most of these horses have back pain, but still some of them don't. So it's definitely associated with it. And the more sites they have, the more likely it is. If you've got a horse with 13 sites, that horse has back pain. Same with 12. So we have the number of sites, but we also have how severe it is, right? We go back to our grading scale. So now this is the same data, but looking at the grading scale. So a horse that has, 0 overlap, again, we're up at our 65%, that same number we saw before. And now horses with grade 3, grade 4, grade 5, grade 6, grade 7 do have back pain. And really, especially this kind of grade 4 seems to be where you see mostly, about 80% of those horses have back pain. So those are the two questions that I'd ask. If you have a horse that has x-rays consistent with kissing spine, the number of sites is important. And then the grading, how bad are they? And they might grade differently, like those examples I showed you. Maybe they're grade 4 over here and they're grade 3 over here, but you need to have all that information to decide if this is actually clinically relevant. And then how do you treat these horses? So I know we're talking a lot about breeding and genetics, but if you have these cases, what can we do for them? So this was actually polling a bunch of surgeons in Europe. So this is the European College of Veterinary Surgeons and then the American College of Veterinary Surgeons. And they said, when do you decide to go to surgery? So about 8% said we won't go to surgery no matter what. The majority, 76%, said we will take a horse to surgery, but we will try conservative treatment first. And if that doesn't work, we'll go to surgery. And then there are about 15% that go right to surgery. They don't try the conservative management. So it's a little bit surgeon dependent and based on their experience. And then what kind of surgery do you do was the next question. And so this was interesting because it was divided kind of in perfect thirds. So a desmotomy is where you go in and you just cut the ligaments. So those two dorsal spinal processes I was showing you that are close together, they have ligaments that are holding them together. And so one of the surgical techniques is you pretty much go in with a big pair of scissors and you cut the ligaments. So about 36% of surgeons will do that. 30% will cut the ligaments, so that's a desmotomy, but they'll also take out a little bit of the bone. So if those pieces are close together and you cut the ligament, maybe you'll let them separate apart. But if the bone's touching, you might want to take out a little wedge of the bone. So that's called a partial ostectomy, is when you take out a small piece of the bone. And then 23% won't, they'll just go in and take a piece of bone out without the desmotomy. And then a very small percent will take out that entire top part of that vertebrae. And then there's some other surgical methods described. So again, really surgery dependent. And I will say, whenever you see something like this, where there's not one technique that fixes all the horses, usually that means that not everything, there's no perfect surgery, and it might be really horse dependent. So just keep that in mind. So going back to the cause of this, so there was a nice study in 2010 that looked at warm blood foals and actually measured the distances. And at least in that cohort, it's a pretty small group, it's only 25, but there were no spaces in any of those foals that were close together. So the idea that they're born with this, we still think that's the case, but in this study, they weren't able to identify any at this young age. So the whole issue of saddle fit, right, has come up. Like maybe it's, that that's why they get inflamed. It's poor saddle fit. And there's a really interesting study that I think disproves this completely. So this is an extinct horse, Equus occidentalis, and there are vertebrae specimens of this horse at the Los Angeles Museum. And a group went in and actually measured the back distances in these horses. So these horses are from 40,000 to 20,000 BC, and horses were not domesticated until 2000. So nobody ever rode these little fat zebra-like looking things. They were completely wild. And when they went in and looked at their backs, they actually looked at about 3,000 specimens, and they found some that had these lesions of kissing spine. So kissing spine was occurring back 40,000 to 20,000 BC. These horses were not ridden. They had never had a saddle on. So again, coming back to probably genetic and not something that we have done with our domestication and putting saddles on them. So how do we look into if this is genetic? So the best analogy I give for doing genetic analyses in any disease is I'm effectively having to start with the entire genome. Okay, so I don't know where the gene is for kissing spine. So I'm going to start looking at the entire genome, which is like starting with the world. And I have to map it, meaning I have to take it from that all the way down. So the first step I'm going to do is I'm going to try to get it to a continent. And in that case, that would be a chromosome. So horses have 31 autosomes, and then they have their sex chromosomes. So I'm going to try to get it down to chromosome 4, chromosome 5, chromosome X, whatever it is. I want to get it to a chromosome. But at a chromosome, I still have 250 million possible mutations, right? I'm trying to find the one change in DNA, and I'm at 250 million. So it's better, but it's still not close. So then I'm going to try to get to a state. Of course, I had to put California up. Sorry for the East Coast folks. But this is getting to a region on a chromosome. So now I am at about 1 million base pairs. So I'm better. I still don't have a genetic test, but I'm getting there. I know it's on this region on, say, chromosome 4. And then the last step is to really try to get it to a city, which is getting it to that one single base pair change that's in that region. So this is what we're doing. We're trying to map it. It's a true like needle in a haystack. You're starting with the entire genome and you're trying to narrow it down. So there is one paper out there that was published in 2022 that said that they did this mapping and they found a region on a chromosome associated with kissing spines. So the horses in this population were interesting. So remember I told you that thoroughbreds and warm bloods are overrepresented. They had a lot of barrel racing quarter horses and appendix horses in this population. So about 49 of them here. So we're going across breeds in this study. So we have dressage, eventing horses, hunter jumpers, and they're mostly the warm bloods. But if you look, we've got quarter horses, we've got warm bloods, we've got thoroughbreds. They had a lot of other breeds. So when you do genetic studies, often the best thing you can do is stay within a breed because you don't want to have the breed background throw you off, right? Like if I'm trying to map kissing spine and all of my warm bloods are affected and all of my quarter horses are normal, if I compare those two, I'm pretty much going to map being a warm blood. I'm not going to map the disease. So I have to have the genetic background being the same. So they did go across breeds in here. And what they found, this is called a Manhattan plot. And the reason it's named that is because when you get a peak, it's supposed to look like the skyline of Manhattan. But each of these dots is a genetic marker. So we have these things called SNP chips, which are just genetic markers across all the chromosomes. So here's those 31 autosomes I was telling you about. And autosomes means males and females have them. And then the X chromosome. And sorry for all the men on the call, but the Y chromosome is not big or important enough to have any genetic markers on it. So it's not on there. And then this is the negative log P, meaning the most significant. So each dot is a SNP. So when the dots kind of get above this line, which is our significance line, we take that to be, we mapped it. So in this case, the group said we mapped it to chromosome 25 in this region. And so if we go back to our little diagram here, this is where we're at. So they said we mapped it to a region on chromosome 25. And what you typically do then is you say, okay, here are some markers, here's the region, let's go in and look at the genes, let's see if there's anything that makes sense. But you also validate it. You go take a whole nother population of horses. And I would say, since these were mostly barrel racing quarter horses, I would love to see this replicated in a group of warmbloods. And you say, or thoroughbreds, you say, do they have the same thing? And so that hasn't been done yet. And I will say in our group, we've gone into some thoroughbreds that we have x-rays on that have kissing spine and don't. And we've tested these markers and it doesn't look like it's holding up. We haven't published that yet. But unfortunately, there is this test out there. And I have pretty strong feelings about putting tests out that are not confirmed, because I think people start to use them and they assume that they're correct. But if you look at these regions, a gene or region, this BIEC2, all these are the two markers that they had on chromosome 25. So it's not a genetic mutation for kissing spine. And I would argue they're actually not validated markers yet. And if everyone comes out and validates them, I will encourage this. But for right now, this is not a valid genetic test. And so if you do hear that there is something out there for kissing spines in genetics, I would say that this is not worth spending money on. And I think that if you start to do that, the results are going to be a bit complicated because, again, it hasn't been validated. So I'm happy to chat more about that in a discussion, but genetics is going to be very buyer beware, because companies now, right, this isn't coming from a university, this is a private company, can make tests and they can sell them and there is no oversight. So human genetics, it's very tightly regulated. Veterinary genetics is the Wild West. If I want to put a PCR in my garage and say I've got a test for something, I can do that and nobody can stop me. So this is something where if you think there's a genetic test, feel free to email me, work with your veterinarian, have your veterinarian email me, but we can go through if it's validated or not before you spend time and money on it. So just to wrap up kissing spine, it's really important to correlate the x-ray findings with the clinical signs. Again, you can have an x-ray that looks pretty bad and the horse is fine. And I would say the bone scan can a lot of times be more bang for your buck than the x-rays if you suspect that. Again, response to the block is really important in these cases. And it's been around for a long time. So this isn't something new, right? Remember that extinct horse I showed you? It's not caused by saddles or the rider. It's likely genetic, but right now we do not have a test for it. Okay, so with that, now we're going to go further up the spine and start talking about neck malformations. So before we get into the lower neck, I want to just specify the difference in what we're talking about. So CVCM is cervical vertebral compressive myelopathy. And it's got, everybody wants to name it something differently. Everybody that I know calls it wobblers, right? So what wobblers is not what we're going to be talking about this morning. Wobblers is where you have this true compression. So this is where the spinal cord should be running. And here you've got it really, really narrow. And so that bone pushes on that spinal cord and that horse becomes neurologic, doesn't know where his or her feet are, and they have issues. So this is something very distinct from what we're going to be talking about in the lower neck. So just keep that in mind. Now, this CVCM is genetic, but it's also nutritional. It's also fast growing horses. It tends to be more in male horses. It's not that straightforward. We are looking at it, but I would say it's more complicated than just a simple genetic test. But these horses with compressive myelopathy or wobblers are neurologically abnormal. They don't know where their feet are. And that's not always the case for some of these C6, C7 horses. So as I kind of talk about this anatomy, let's just review this so we're all on the same page. So here's the pole of the horse. The first vertebrae is C1, and that's sitting right here. It's also called the atlas. C2 is the axis. So now we're going down the horse's neck. And then these two are really distinct. C1 and C2 look very different. 3, 4, 5 tend to look the same. So the places where we find those wobbler horses are typically in this region, C3, C4, C5. And then what we're going to be talking about are these lower neck bones. So C6 and C7 are the ones that go right into T1 is the first thoracic vertebrae here. And that's where we start to get to the spine that we were just talking about. So we're going to be speaking about this lower part of the neck. But before we do, I'm going to digress into a story about Arabians for a second, because hopefully you guys will find this as interesting as I do. So the Arabian breed, right, has been selected for this kind of dish-shaped head. This has been a long time coming, right? Is this kind of really articulated poll and this dish-shaped head. And because of that, they've had some genetic issues. So this is a filly that I saw. She's 1 week old Arabian filly named Hope, which is sometimes not the best name for young horses. And she came in because she was ataxic, meaning she was incoordinated. She had trouble raising her head to nurse off of her mom. And then she had this kind of awful clicking noise in her neck when she moved her neck. So this part right here of this bone where this yellow arrow is should not be jutting out like that. And so we went ahead and took x-rays of her neck, and what she had was a malformation at the top of the spine. So this is normal x-ray from the top of the spine. This is the base of the skull. C1 to me always looks like a duck eating the back of the skull. None of the radiologists agree with me, but that's how I teach the vet students. It looks like a duck eating the back of the skull. C2 is really obvious. It's got this big process, and then it's got this thing called a dens that sticks into C1, and that's how these two articulate. And then you've got C3, and then you go down. So we take multiple x-rays. And if we compare normal to what's going on with this little filly, C1, here's your duck eating the back of the skull. And then I don't even know what's happening here. This is just kind of like a traffic jam of bone. C2 is completely abnormal. It's kind of pushed into C1. And there's that little piece I showed you here, that dens is gone. There's nothing there. So this was completely malformed in this little filly. And so in Arabians, we call this occipital atlantal axial malformation because the occipit's the base of the skull, the atlas is C1, the axis is C2. So this whole region is malformed in this little filly. And this is inherited in Arabians. It's been around for a really long time. And one of the interesting things our lab looked at is if you look across organisms, so like all the way from fly to human, there's a group of genes that specify what parts of your body turn into what. And they're called these homeobox genes or Hox genes. So there are genes here in pink that encode for the base of the skull. There are genes in purple that encode for C1, C2, and so on. And these are very, very well conserved. Like if you knock one of these genes out in a mouse, it won't get born. They're really important. But because they're so important, we thought, I wonder if something's going on with those genes that turn that region of the neck into, right, the atlas and the axis. And the other reason we suspected that is because there was a mouse paper that came out where they knocked out HOXD3. So if we go back here, HOXD is right here. HOXD3 is this purple guy right here, which encodes for the region we care about. And so they took it out of a mouse to see what could happen. And when they did that, they effectively got the same thing that we see in the horses. And they wrote in their paper, this was back in 1993, they wrote in their paper that those knockout mice look exactly like what's going on in Arabian horses. So we went ahead and we looked at that gene. And so we're here now. We said, okay, we're just going to look at that gene and say, could this gene be abnormal? And it was. There was actually a huge deletion right by that gene that was causing Hope's problem. And so there is a genetic test for this now in the Arabian horse. So I wanted to give you this as an example of how you get from what's going on clinically to a genetic test. So now let's go back to our warm bloods. So we talked about wobblers, and we're going to kind of leave that off to the side. Now we're talking about lower neck. So these are x-rays from the lower neck. This is C6 and then C7. And what you should see in C6 is this really nice white line. which is called the ventral lamina, sorry, of C6, and it should only be on C6. And what's happening in a lot of horses is if you look at this one, this horse is affected, that ventral lamina is gone. We don't see it here like we see it here. And now it's actually on C7. So somehow it didn't develop on C6 and it developed on C7 instead, which is, and it's been around for a while, but we're seeing it, I think, more and more. The average, I think the counts are about 30% of warm bloods that have x-rays of their lower neck will have this. So the question is, well, what is it doing? And is it actually causing a problem or not? So these papers are kind of hot off the press. This was just last year. Dr. Dyson's group did some really nice studies looking at warm blood horses and saying, do they have problems if they have this versus they don't? So there were 223 warm blood horses, 96 cases, and by cases, they either had neck pain, stiffness, ataxia, meaning they're incoordinate or neurologic, or lameness related to their neck. So there are some horses that present that you cannot block a front limb lameness out, and it turns out it's their lower neck. And then they looked at 127 controls. So these horses did not have that C6, C7 that were from pre-purchase exams. And what they found was that the transposition here was in about 17% of the cases, and it was in about 30% of the controls. So what they're saying in this paper is that, hey, we actually found this thing in more of the pre-purchase horses without problems than in the horses with problems. And so they don't think that it is a problem because of this. So that was the first set of papers that came out, was it's incidental, it's not causing a problem. Then another paper came out same year from Colorado and said, actually, in our cohort, it's not causing neurologic disease, meaning the ataxia or incoordination, but it does seem to be causing neck pain in these horses. And so they had 135 horses, so smaller group, 60 of them were warm bloods. And what they found was they had put them in different categories. So these are the CVCM horses. These are the horses I was telling you about that have the compressive myelopathy, and they can have it at C6, C7. They had horses with orthopedic pain to their neck. They had horses with lameness that referred to their neck. They had horses with primary neck pain. They had other neurologic diseases, and then this other category. And the black bars are the horses that have that 6-7 malformation. What they found was the horses with neck pain were much more likely to have the malformation than the horses without it. And if you kind of go back to what about that other study that said there was no problem, they actually didn't divide them into subgroups, where they put all the affected horses into one category. So they had ataxic, neck pain, lameness, all in one category, whereas this Colorado group said, well, hey, let's look within the category. And when they did that, it looked like those horses with that change had neck pain. That being said, really the jury's still out. I was at AAP last year with a table topic on this, and nobody really knows the right answer. There's a lot of discussion as to if these are clinically relevant. I will tell you though, with the advent of CT myelogram, we are going to be able to hopefully answer these questions. So x-rays are good to a point. So CT myelography is where we effectively can anesthetize the horse. We can do a full CT of the neck. And then in these images, this white here is actually contrast around the spinal cord. So we can't see the spinal cord on CT, it's black, but we can surround it with contrast. And so as we go down the cord, here's C3, 4, 4, 5, 5, 6, all of a sudden you get to 6, 7. And can you guys appreciate that that ventral lamina is missing on one side? It's here on the side, here on the, and this is flipped. So it's here on the right side, it's absent on the left side. I mean, and this to me is a lot more obvious than looking at it on x-rays, right? It's very, very clear. So we can also start to see if this is missing on this side, is there something that happens to make up for this, I mean, effectively asymmetry, right? The horse is asymmetric. And if you look at these are the joints, the articular facet joints in the neck. That, see how big this one is on the right side compared to the left? So we've been seeing this more and more, is that when they're missing that piece on one side, the horse seems to try to compensate by putting more bone down here. But what eventually happens is that this can keep growing and start pushing on the spinal cord. So, you know, the neck pain we're seeing, could it be due to this? And again, the jury really is still out on this. So what about the genetics? of these C6, C7. So this is Dr. Distel's group. They're in Hanover, Germany. They did a really nice study where they took 20 German warm bloods that had the 6-7 malformation. They looked at their pedigrees, and they actually all went back to a subset of thoroughbred stallions who also had the malformations. So their conclusion was that this does look to be genetic. However, they didn't have a control group, so it's a little tough to say for sure, but it does seem, again, like this is something very old that's happened and that we've now just been seeing more because we can also x-ray better than we used to be able to. So I just want to bring you back to the fly baby diagram, right? So if we go back to that same thought that we did for the Arabians, and now I'm going to add a horse to it, could we focus on these genes, right? Because it's the same body map, and it's going to correlate to here, and it's going to correlate to here. And so could these homeobox, really the 6 genes, be the ones we should be looking at in these warm bloods? And what I've told my clinical colleagues is that I can do the genetics. I can tell you, right, if you tell me this horse has T6, T7 transposition, right, that flip, and this horse doesn't, we can figure out the genetics. We can get a genetic test. But then as far as does it affect performance, does it affect disease, I think that will be for the clinicians to do. But it's going to be a lot easier to do it with a genetic test than it is to be x-raying necks all the time. So this is our hypothesis on this, is that this is a region to look at like we did for the Arabians, further up north at C1, C2. And I think for further support of this, there was this paper that came out that looked at how we have genetically selected, in this case, German warm blood horse breeds. And what they did was they just looked for genetic markers to say, like, what have we picked to say we really like this? Either, sportiness, talent, look, whatever it is over the years. And they did this for the modern sport horse. And some of the top genes that came out are these homeobox B genes that I just showed you. So in warm bloods, we have selected for these Hox B genes, for whatever reason, probably they are associated with, scopiness for jumpers, movement for dressage, but have we kind of pushed ourselves into that? Well, now we've got some of this lower neck issues. And so that's what we're going into. And we did just put in a Grayson grant this year. It's a very, very multi-institution collaborative team. So there's folks here from Rood and Riddle and Penn and Colorado, in order to try to whole genome sequence these horses, just like we did in the Arabians, and figure out if we can find the needle in the haystack that I showed you in that example. So just to wrap up, this is kind of the things that keep me up at a little bit at night. If we think about how different these breeds are, but we also think about what we have selected for, I think everything with genetics is we're pushing what we want that's good, and sometimes we get things we don't want. And can we, if we have certain tests, could we keep the stuff we like and move away from the stuff we don't like? And just so I didn't want to exclude the dressage horses, right? We want that kind of elevation we can get in the front end, and that lower neck is so, so, so important for that. So just to wrap up, there are a lot of changes to the axial spine that I think we're getting to know more and more about, especially with imaging now, but there's still a lot we don't know. Genetics likely plays a role, but these malformations are not new. They've been around for a really long time. And then I had the opportunity to meet with Dr. Marie last week and talk about what they're doing for the stallion registry. And it's really impressive. You guys are very ahead of the time. For kissing spine, those severe cases are excluded. They cannot be registered as a stallion, which I would 110% agree with, because those are the really bad congenital ones, like that mare I showed you. And then for the necks, if they're obvious wobblers, meaning they're compressed, they're excluded. Otherwise, if they have these C6, C7, they're going to be monitored, right? So they're going to have x-rays, and we're going to be able to see over time if we can monitor them, which I think will be such a valuable data set to have for the breed. So my how to get involved, if you have a suspect case, you own one, you know someone with one, please have your veterinarian contact me. I need to, for legal reasons, do these through veterinarians because I'm not seeing the horses directly. So they can contact me, and what I would need would be the full medical record, including the imaging on the horse, the pedigree, and then we're used to hair samples for DNA, but when you're doing genetic investigations, you actually need a lot more DNA. So a whole blood sample is actually ideal for that. And then we can cover the shipping costs for the whole blood sample. And the other really important thing is we provide complete confidentiality. So I've investigated genetic diseases across many, many breeds. We've come up with about 8 tests that we've put out there. We have never, ever compromised confidentiality. So the horses get coded with a number and their pedigree is kept confidential, even once a genetic test is out there. So with that, I need to thank all of the funding sources. That's really how this work gets done. So the UC Davis Center for Equine Health, Grayson Jockey Club, the Arabian Horse Association funded the Arabian work, and Morris Animal Foundation. And then this is my wonderful team of students and the 2 Jack Russells, that do a lot of work in the lab, but nothing can get done without them. And so with that, I'm happy to open it up for questions, and I can work on going through the chat. So feel free to put something in there if that would be best.
Thank you so much, Dr. Finno, and also want to welcome Jacques Marais, KWPN board member and doctor or vet as well, a veterinarian. And we already have some questions in the chat. Carrie,
Yeah, I
your
was just looking at
presentation was fantastic. It was very clear to everyone, I think, explaining quite a complicated matter. Thank you so much.
Yeah, no, Renee's got a
Welcome,
good
Jacques.
question here.
Welcome to everybody. I don't know whether it's good day or good morning or good evening, but here in the Netherlands, it's already evening. And thank you for the excellent presentation. It was very clear and very interesting to see how genetic development is arising in horse breeding.
Thank you, Carrie. Carrie, can we give you the word to answer the questions in the chat, or do you want me to read them up?
No, I've got them. I think Renee had a great one about the correlation with starting young horses to kissing spine, because quarter horses and thoroughbreds are started at a very early age. And yeah, I mean, that's been out there, right? Is that are we doing it, starting them too early? But I do think that honestly, for me, that study of that, prehistoric effectively horse or pre-domestication horse, like it doesn't get clearer than that, right? Like they had it and that horse never had a saddle on. It's kind of the best population. So I don't think, I mean, could you make the horse back sore? Sure. I mean, that might be happening where the horse has kissing spine and you're making it more sore, but I don't think you're causing the kissing spine with tack or starting early, or the rider that, myself included, amateurized rider, right? Like I don't think we're causing it. We could be leading to the back pain. So but it's a great question. I just think that when you can look at anatomic specimens from a museum, and the same thing with the lower neck, like that's in anatomic specimens that they have that transposition. So that's, to me, is like, this isn't new, right? This is something that's been around for a while, and maybe we weren't catching it, maybe we were imaging it. Now we're seeing it and it's a hot topic, and I think we need to figure it out. But it's not new. So great questions. The other question, do horses that have the malformation of C6 and C7 have an extra rib? Karen, that's an awesome question. So there's a variation of that. So the tough thing about this malformation is that some horses are missing one side of C6, like that CT I showed you. Some horses are missing both. And then some horses put it on C7 and some horses don't. So there's all these kind of permutations of it. And then you're right, there's some horses that actually are missing a rib on T1. And if I kind of go back to the Arabian story, that whole mess that happens up in C1, C2 is because when they develop, C1 looks more like the back of the skull and C2 looks more like C1. So there's this like shift, right? The body plan's messed up, and it's messed up by one vertebrae north. So if you go back to C6, C7, T1, is it that C7 now looks like C6, right? And T1 now looks like C7, so it doesn't have a rib. So that it's the same thing we're seeing in the Arabians, but in the lower neck. And I think kind of going back to those Hawks genes, I mean, I'm not really a betting person, but if I'm betting today, March 8th, that's where I'm going to put my money, is on those Hawks genes. Another question, the literature seems to suggest that clinical kissing spine is perhaps more prevalent in thoroughbreds. Do I think that warm bloods and quarter horses show greater muscle mass and may have fewer symptoms, right? That muscle coverage could be protective. Yeah, I mean, it could be. I think the back pain part is really interesting, right? Like some horses, you look at the x-ray and you're like, oh my God, that's awful. And yet they're doing their job and they're fine. And is it just a matter of time before it catches up with them? I don't think we know the answer to that. We see it in quarter horses, but not nearly as much as we see it in thoroughbreds and warm bloods. And so I don't know. I've seen a lot of really muscly warm bloods that have it still. So I don't know if that is some protective thing or, I mean, there's also the question of fat, right? You could have a little more layer between the saddle and those bones. But I think it's interesting. It does seem to be kind of the thoroughbreds and warm bloods is where we're going to see kissing spine more, but we have had it in quarter horses. And then Lisa asked, can young horses grow out of it, right? So if they're x-rayed at 3 and find it, since they're not finished growing, can the diagnosis change? Typically, if they're close together, they stay close together unless a surgeon goes in and cuts them apart. So I think the x-rays would still look relatively the same. But if that horse is in less work, could it have like less remodeling? Perhaps. I don't think anyone's really done that study. And we need to follow these horses out. And then do we know the thoroughbred ancestor that's connected? There's quite a few, Elizabeth. There's Eclipse is a pretty famous stallion that has it, and it is like the sire of so many of our modern sport horses. So there's quite a few that have it. And in Dr. Distel's paper, I think he had like 3 stallions that it looked like in 20 Hanoverians that it went back to. So I think we need more. Okay, I think I concisely, hopefully answered most of the questions in the chat. Oh, and
Yeah,
Megan's
there's a lot
read
more.
recently. Yes, some horses actually have muscle pain as well. The back pain is an interesting thing, and I had the chance to. I was shopping for a horse myself, and I went. I'm an eventer. So sorry, everybody, I event, but I went and sat on a thoroughbred that when the gal showed him to me, she didn't canter him, and I was like, that's weird. So I got on him and I trotted him, and he felt fine at the trot, and he would not canter. And he just pinned his ears and just couldn't do it. And she kind of made up all these reasons. And anyways, we ended up taking x-rays of his back, and he had awful kissing spine. So I think that they can have the back pain that manifests like that, like a saddle fit, things like that. Kind of overall muscle pain is a little bit separate. It's probably secondary too, right? If your back feels awful, you kind of feel awful everywhere. So I think you can see that. And then other neurosigns that we see with C6, C7 malformation, Elizabeth, it really depends. We've had some horses, you don't see any. I mean, there are horses that are competing at the top levels with these and don't seem to have a problem. And then there's other horses that maybe are ataxic or uncoordinated, but it does seem like neck pain is more common than quote unquote neurologic disease. So I think neck pain for those lower neck things. Tracy loves eventing. Thank you, me too. And then Anna, can a young horse with clean x-rays for C6, C7 at 3 then develop changes after starting work? So they cannot develop this transposition. They are born with this. So it can't be like all of a sudden, right, the vertebrae switch. What can happen is with work, they can get arthritis. If there's imbalance, like that can develop just like in any joint. But the malformation is there at birth. So, whew. Okay, I think I caught up.
Carrie, if I
Yes.
can disrupt you a little bit, how do you say this? I have a question for Jacques, actually, that came in through the chat, through my own chat. And a person asked me if what is going on with the DOC predicate testing? Is it still like, is there going to be more study about that? Someone is asking specifically for the DOC. Can you say something, or are you wanting to refer to?
Can you hear me?
Yeah.
Yeah. No, we're definitely moving on with the DOC predicate as we use it now in our stallions and mares. The problem that we had with the DOC in the last decade, I can say, is that we were not selecting so much on it. when the DOC was introduced, it was the selection rate should be the same as on the old way with the images. But the problem is the DOC is something that which we measure or which we find in the genes. And if you look at the old system where we use the X-rays, there was always a pre-selection of X-rays before they were sent into the stud book for evaluation. So at the end, we found that selecting as we did on DOC was on the same level as we did in the old system with the X-rays. So now we have changed a few things, and we're going to change a little bit more. First, if a mare wants to be an elite mare, we're going to level up the DOC from 96 to 99, and stallions which are not clear on the old proc system or on the recent proc system, because we also changed a lot of things on the X-rays, but which are not clear on some parts of the hock joint or the stifle joints, must have a higher DOC than other stallions. For example, if a horse is normal on the X-rays, there's no issues there, then he's allowed in the breeding program with a DOC of 96. And if stallions have some changes at, for example, the intermediate ridge of the hock joint, then they are allowed in the breeding program, but they have to have a DOC of 99 or higher. And we are re-evaluating that. And I think in due time, the DOC grades will go up and the selection will be a little bit more firm in regard to the DOC. Does that
Thank you, Jacques.
answer your question?
Yes, I have another question saying, are you talking now about proc versus DOC?
Yeah, there was a change 10 years ago that everybody said what you can see in the genes, that's better than what you can select on an individual horse. And the proc was on individual horses. And then in that decade, we saw that the quality of the soundness of our KWPN horses was declining. And last year, we made a board of an advice group of 10 veterinarians and said, how can we cope with that problem? But only selecting on X-rays of the navicular bone and the hock joint in combination with the DOC does not help us very much. Now, one of the points we found out is that the DOC was not selecting firmly enough, and other issues involving normal pre-purchase exams on sport horses were also getting more important, so that the advice group said, okay, we're going to reintroduce the proc with additional images and back and neck as a selection tool for stallions. And we're going to select a little bit more firmly with the DOC, especially in the elite mares, and in these stallions in which we find minimal changes in the hock joint or the stifle joint in regard to probably OCD. You never know sure whether it's the genetic component or the way these horses were raised. And these stallions have to have a higher DOC than the other stallions.
Thank you. I have another question. How were the radiographs pre-selected? I didn't understand what that means.
Well, if you normally in practice, these 2-year-old stallions were X-rayed by private veterinarians, and if horses were found with a fragment, either in for example, a fragment in the hock joint or in the stifle joint, these images were not sent to the central committee, which will judge these images for the stud book. So we were not getting all the good information in regard to the X-rays, because a lot of well, I think about 30% of the images that were taken on horses, 30% of these images of the horses which were positive on OCD or fragmentation in one of the joints were not sent to the official committee, so they were never introduced in the statistics that we make of these images as a stat book. So, and if you and the problem was that the advice committee for breeding said if we gonna introduce the DOC as a selection tool, then it must be not more firmly than the old selection tool by images that we use that we used until now. It's how can I explain that easy? From all the images in the old system that were evaluated, about 8 till 10% of the horses were positive on osteochondrosis and declined from breeding. And the breeding committee or the breeding advice group said, okay, we want to have the selection in the same rate with DOC as we used to have the selection on images. What was not taken into account is that all the images that were sent for evaluation were not the total amount of images that were sent. There was also already in practice a lot of these about 30% of the images from positive horses were not sent. So the total amount of positive horses on osteochondrosis was way higher than we suspected. Is it understandable for everybody, or is it a little bit difficult to what I explained?
I think so. There's no direct questions about this topic coming in right now anymore. So thank you. I think we can do one more question and then add a little bit more information about or emphasize how people can help UC Davis and Carrie Finno's program that we will share, what she already shared in her presentation, how you can have your vet send the information to Carrie, right, Carrie, to help with that research. The last question, Kathy Hickerson is asking, Jacques, are you finding more stallions are being eliminated now from the selection process?
Yes. For example, this year, normally we lose about every year, about 90 jumping stallions go to the second round in the stallion selection. Normally we lose 2-3 stallions every year, and this year we lost 17 on the X-rays combined with the DOC. So the selection in the jumping horses was quite severe, and we lost about 20%, where we lost in other years 4 or 5%. So the selection was
interesting.
Yeah. In the dressage horses, it was not so bad. We lost about 10%, and normally we lose in the dressage horses about 2 to 5%. So in the dressage horses, it was also more, but in the jumping horses, it was really more. And we have to be a little bit cautious with that. What was surprisingly that the stallions that we lost in the jumping, in the selection of the jumpers, were mostly where there was a lot of Belgium influence in the pedigree.
That's interesting.
Yeah, that was interesting for us.
Do you take note of all these things? Like, is the KWPN writing it down somewhere to keep a log on it?
Yeah, they will be. Everything is logged, and we have to have quite a lot of numbers to do statistics on them, but in due time, it will be done, and it will also be published.
Okay, thank you, Jacques. Sorry, I have to close it off for Carlos and Mary that had another question, but we really want to stick to the schedule because we have invited a lot of other people to join the call later on that have a very short time to log on. But we can answer your questions later, right, Jacques and Carrie? If people have more questions, they can send them to us and we can ask you and then make sure that they get their answers, right?
No problem.
Thank you
Absolutely.
so much. I think our members really appreciated everything that you shared with us.
Thanks for the invitation. It's great to talk to you guys, and we're all in it for the horses to be better, right? Be more successful. So that's the whole goal for all of us. So thanks, guys.
Thank you.
For sure.
You.